I am a professor of psychology at Oklahoma State University. I've been working there since 1995. My background is and training is as a clinical psychologist, specifically as a health psychologist and a pediatric psychologist.
Okay. And then just your background with football. Obviously, we've talked, and Taylor played football. Your two sons that you have right now play football. Can you just take me through kind of the background?
Sure. I played sports as a kid, played baseball and football. My father had been a high school basketball coach, and so I grew up with sports. He went on to get a degree in higher education, but certainly he kind of infused our love of sports in the family. And then I had Parker and Taylor. They were both involved in sports from an early age. Most notably, YMCA sports, starting with soccer and t-ball and baseball. And then by the time that Taylor and Parker were in middle school, they were allowed at that point in time to go ahead and play football. At that point in time, there was not a lot of media attention on issues related to concussion, but of course, as a parent, there's always a concern that in a contact sport like football, that someone's going to get hurt. Taylor made the decision to go ahead and continue to play football all the way through high school. Became a starter, I think, his sophomore year, junior year, played on the line, and his mother and I had a lot of discussions about, kind of his health status. He, I think, was fortunate, at least to our knowledge, to never have had a concussion or a serious concussion, either in practice or out on the football field. It may have helped that he was on the line and wasn't constantly, getting hit like a running back would or a receiver. But always there was a concern about injuries. And, I'd be the first person to admit that a lot of times you would attend games not just to see them play, but to make sure that you were available if they did get hurt. Taylor was fortunate to not have any concussions, but by the time he was a senior, he had developed some stress fractures in his back and was sidelined about half the season. So,
where did Taylor and Parker play high school?
They played high school in Edmond. Parker didn't play high school football. He decided to go a different route and was involved in band and played soccer. I'm not sure if he just didn't like all that contact or what. So Taylor played at Edmond Memorial, which is a 6A high school team. So they're playing a lot of other big teams with a lot of big, fast kids.
Yeah. And then take me through your two sons right now. They're what age they're about and kind of where they're getting started with.
Okay. My two younger sons are now 13 and soon to be 10. Their mom and I decided about the time they were in 3rd and 4th grade, after a lot of discussion, that we would allow them to play football. We started with flag football. About the time I believe that Carson was in 4th grade, they had started a full contact tackle football league through the YMCA. There was also another league through Edmond called the Edmond All Sports Association. We were not inclined to let them or even consider them playing there because of the history of them being super competitive, super aggressive. And we kind of thought that if they were going to be allowed to play tackle football, we would want to go through the YMCA where it was better regulated. And it was our experience that at least in YMCA sports, there was more attention paid to teamwork, camaraderie, working together, having integrity, etc., with a kinder, gentler approach to sports. It was interesting, though, because our experience with football and coaching was a little bit different than it was with soccer and t-ball, in that it was more fiercely competitive, and there were coaches that often had to be, or sometimes had to be reined in a little bit because of their tactics with the kids. That being said, it was also closely monitored all the practices. There were YMCA staff there, and were available to monitor situations, monitor injuries, and so on.
So Carson and what's
Kiefer.
Kiefer?
Kiefer.
Okay, and 13
and soon to be 10.
Soon to be 10. Okay, so they're kind of junior, middle school age.
Mm-hmm.
Middle school age. So
Carson's now finishing his 7th grade year.
Okay. Take me through Taylor and Parker. One of the big things that I've learned in this project is the mentality of football players, I guess. Or they're just the mentality of people in general.
Mm-hmm.
Football players are very aggressive. They really go after it. Do you see any of those kind of traits in any of your sons, and maybe how they go after sports, and maybe what they'd be inclined to do in their future, especially your younger ones?
Well, it's interesting, Zach, because one of the things we noticed with Carson when he was playing flag football, one of the first times he got out on the field, and take into account this is a kid very quiet, a little bit introverted, but a smart kid. He got out on the t-ball field, and the first time he made a tackle, he wrestled the kid to the ground and ripped his flags off. And throughout that first season, continually made tackles and evidenced no fear whatsoever, which was, in a sense, shocking to his mom and I, because we had not seen that side of him. It wasn't that he was overtly aggressive, but he loved the competition. And he showed, a lot of propensity to be good at being a football player. And I think, quite honestly, that's what kind of inspired us to go ahead and consider him playing tackle football, was that kind of natural ability coupled with his ability to learn the game. And we just kind of thought, well, if he's really wanting to do it and he's good at it, we need to consider letting him play tackle football, despite the fact that he was going to be at much higher risk for injury.
What's your background with concussions? I know you talked a little bit to me on the phone about just kind of you have that background. Can you just take me through kind of the extent of that?
Well, as I said before, I grew up playing sports, and concussions were not part of the conversation at that point in time, and people got hurt, certainly, but that was part of football, but typically people did not get seriously hurt, and there was no focus on concussions. Occasionally you'd hear about a kid who was out of shape and was going through conditioning, or they had an underlying heart problem or whatever, and they would, sadly, pass away during conditioning. But that seemed like a really rare event. Going through graduate school, I specialized in health psychology, and as part of that, I worked on inpatient units where people had traumatic injuries. And so I was used to working with people with traumatic amputations, spinal cord injuries, but also head injuries. By the time I completed graduate school, I had experience in working with individuals with traumatic brain injury, severe concussions, etc. But usually those were through car accidents, some other kind of blunt force trauma accident, but not through sports. There was a postdoctoral fellow that I worked with, though, who was a neuropsychologist, and he was fascinated by boxing. And I remember that he was looking at, as part of his research, the impact of participating in boxing on long-term brain injuries. And we actually went to a boxing match in Oklahoma City at the Central Plaza Hotel years ago, just to watch them box. And that was perhaps my first encounter with the idea that concussions were a part of sports. And subsequent to that, over time, there's been an increasing focus on concussions in the context of football. With more focus on prevention. The NFL, lawsuit, that has produced a settlement for football players. So it's much more in my awareness now, and I'm very sensitive to the fact that indeed, there are risks involved in this sports, which I think I take very seriously, and my wife takes very seriously when we think about letting the kids participate in sports.
And you bring up a very good point, and a major point of my documentary, just the idea of risks. You talked about how concussions that you viewed were in a almost everyday kind of setting. Us as humans going out, making choices, car accidents happen, whatever it is. Just anything can happen. We don't know what lies forward with us. But at the same token, that's true with sports too. We take that risk to step out on the field or the court, and we don't know what's going to happen. How much, I guess, just take me into that sense of risk. How much risk are you willing to, I guess, push the boundaries of with your sons when you see them play sports until it's time to say no or make their own decision or whatever it may be?
Well, I think the first kind of approach to that, Zach, has been to have them involved in as controlled a setting as possible, and to that extent, we've had them involved in YMCA tackle football, which is closely monitored. There's lots of attention paid to training the coaches in appropriate mechanisms of how kids should tackle. And I have seen time and time again coaches pull kids off the field after a tackle to remind them about the need to keep their head up, not put their head down, and that's reinforced through their drills day in and day out. So that helps me feel better about the potential risk. I would not allow my kids, nor would their mom allow the boys to participate in any kind of a league in which there was not a strong focus on safety first. I can tell you that as Carson got into 7th grade and was able to play football this past year, the coaches again were focused on safety and teaching kids how to tackle appropriately. I even saw for the first time in my life in a middle school football game an offensive receiver get flagged because he put his head down and hit a kid who was trying to tackle him. I'm used to seeing defensive backs get penalized, but this was a big kid, and I was really pleased that the referees were even attending to that. So that being said, again, we monitor it closely. I think I mentioned to you before, we have bought our kids special helmets at no small expense that have been designed for extra protection. So we've taken that step. I think too, it's safe to say that if one of them was to sustain a concussion, we would be taking them to their physician, to a neurologist, and we would follow every safety procedure possible. And my experiences in this day and age, essentially they pull kids out and they're not allowed to participate anymore, after a concussion. And that's something that we would certainly do, is just pull them. I don't think that we're prepared at all to allow our kids to sustain continued concussions over time. It's just, there's just too much evidence occurring at this point in time as to what the outcome could be. And there are other sports that they can clearly participate in that involve less risk. Mm-hmm. Although I've seen some pretty heavy-duty collisions in middle school basketball as well. Yeah. And lacrosse.
I actually talked last week with Steve August.
Mm-hmm.
He was an offensive tackle for the Seahawks back in the 70s, and he was talking about how his kids have kind of not followed in Dad's footsteps, but they've played more lacrosse.
Mm-hmm.
And that sport is growing tremendously.
Absolutely, it's growing in Edmond. Every weekend the kids are out at the middle school practicing, and it just grows and grows and grows.
Well, what is as a doctor of psychology, how does that help you? I guess maybe make more informed decisions than maybe perhaps other parents or other individuals who maybe don't really know so much about what goes on with the brain with an individual person and just kind of how they function.
Well, first off, I think that it certainly increases my awareness of the risk. The brain is resilient in many regards and very fragile in others. And ultimately, at the end of the day, if you don't have a good intact brain, it makes it really hard to negotiate the world and to be successful. I also take into account, I know the facts and figures, on the percentages of kids that play sports in middle school and high school who will go on to have that as a career. It's incredibly small. And so, from my perspective, it's not worth the risk to put them in harm's way repeatedly. I think the other side of the coin is, as a psychologist, you think about, well, what choices do I allow my child to make, and at what point in time? Do I allow them to make a choice to continue in a sport when they're getting hurt repeatedly and seriously? And I think the answer to that is no. You kind of insert yourself as a parent, and you set limits on how much is enough. On the other hand, you also are aware, I think I am as a psychologist, what happens when you forbid your kids to do something that they truly love and are passionate about. Part of my research has been on, in the context of chronically ill kids, overprotective parenting. What we know is that a certain subset of parents become incredibly overprotective and don't allow their kids to, in a sense, be normal. And those kids are at higher risk for depression and anxiety because they look at the world as just an incredibly scary place, and that's very threatening. So, for me, I think as a psychologist, we try and find that balance, in terms of giving our kids choices, and that is true for sports. It's true for the courses that they elect to take when they get into high school, whether or not they get a motorcycle, what kind of car they get to buy. I have my second to the oldest. Whenever he was getting ready to turn 16, I made what I think was a thoughtful decision to give him a car that was essentially a steel reinforced box, because I knew that as smart as he was, he got distracted easily, and he was at higher likelihood to have a wreck. And sure enough, 8 months after getting his license, he had fortunately a relatively minor wreck, but was in a very safe car. So, you try and make thoughtful decisions for your kids, but realize that you can't completely protect them from everything.
Is there a line of sustaining injuries in a sport and going through the correct steps to ensure their safety so that they can continue to play versus perhaps letting them play and knowing that they're extremely talented at the sport that they play, but maybe not having necessarily that background of safety. So I guess the question would be having that sense of protection, like you kind of talk about, making sure you go through the steps,
Mm-hmm.
versus having how talented they are. Kind of, is there a line drawn between the talent versus the risk that you have?
That's it.
And kind of what you talked about is not overshadowing them as a parent.
That's a great question. If my sons had not loved the sport as much and hadn't been as talented, then we probably would have encouraged them to go a very different direction. So, when you see your kids love a sport and you see the benefits that they get from that, and they are busy all the time. They are too tired at times to get into trouble doing other things that kids do in high school. So I think it's safe to say that for my older boys, they were busy enough with sports and band and school itself that there wasn't a lot of energy and time left over to get involved in things they shouldn't be involved in. I also look at the advantage of the friendships that are developed. I think it's very safe to say that for at least two of my sons, sports has been a mechanism by which they've established really good friendships. So there are all those benefits. So I want to encourage them to do that as long as they're safe. If they were less athletically inclined and they were not getting the benefit of, or let me take it back. If they were less athletically inclined and they were getting hurt, I think it's a no-brainer. You steer them in a different direction. So, does that answer your question?
Yeah, that's perfect.
So, and I clearly see some kids out there, and they're not that interested. They're out there because their parents want them to be out there. And I think the good news is most of those kids drop out by the time they're in middle school. They just don't survive.
The parents that live vicariously.
You see a lot of that, and unfortunately, you see that with some of the coaches too. Mm-hmm. And we have actually, Zach, made changes in teams because of coaches' mentality. The yellers and the screamers and those that punish the kids with additional unnecessary drills. Those are not coaches we gravitate towards. So, and the good news is at least up until middle school, you're able to move your kids. Mm-hmm. So.
How much? My main character of my documentary is Clint Trickett.
Mm-hmm.
He played at West Virginia. He suffered 5 concussions in a 14-month span. 3 of those concussions he never reported to anybody.
Mm-hmm.
In fact, one of them, they played Maryland this past year, and he got on their first offensive drive into the game, suffered a concussion, went to the sideline while the defense was on the field, couldn't hardly see, had hardly any vision. Mm-hmm. Regained vision in his right eye, had minimal to no vision in his left eye when he went back out on the field for a second offensive drive. Threw for 500 yards. They won the game. Now, I mean, that's completely mind-boggling. It makes absolutely no sense to me. Still doesn't, right, as long as I've tried to comprehend that.
Sure.
But how important, I guess my question is, how important is it if you do, for anybody, in your opinion, do you see reporting an injury? How important is it to reveal that to somebody? Or in like Steve August's case, he told me if you're injured in the NFL, you're essentially handing over your career. So is there a fine? I guess the NFL's a business, college is more of an amateur
mm-hmm.
game. But where's the line in terms of? I mean, obviously it varies with each level you're at, but where's the line with that of making sure that as an individual you're staying safe, even though there might be consequences of you not playing down the line,
sure,
somebody taking your spot, that kind of thing.
I think for me, we live in a culture of sports that penalizes those who are hurt, and as you just pointed out, to the extent that a player divulges that they're indeed injured, they get pulled, and when you don't play, you don't move forward, our society kind of perpetuates that kind of warrior mentality, which has benefits in terms of attention from the rest of society as well as financial benefit. From my perspective, what I've tried to do is I've tried to teach, my kids, when you're hurt, you need to not play, and you need to be honest about that when you're hurt. And if the worst thing that ever happens to you is that you don't get to play in a sport, you got lots of other alternatives. I've conveyed to both of my younger sons, and I think I conveyed to my older sons too, the likelihood of you being in the NFL one day is relatively small, but the likelihood of you being able to go forward and to be a highly successful, educated individual is about 100% if that's what you choose to do. I know that at one point in time I was asked by a high school coach when I was a senior why I had elected not to continue to play baseball when he was aware that I was pretty good. And I said, because I knew that I would never get an athletic scholarship, but I could get an academic scholarship. So I've really tried to communicate that, to all my kids, is that their success is going to be largely a function of their intact brain and being academically successful. I was delighted a couple months ago. I was driving around Edmond with my 13-year-old and one of his friends, and for some reason the conversation came up about, where do you want to go to college? And this other young man said, well, I think I'm going to stay fairly close. And my other son said, well, I want to go to Stanford. And the other kid goes, well, why do you want to go to Stanford? He goes, well, I might be able to play ball there, but if nothing else, I'd get a fantastic education. And I began to think, well, maybe some of this is sinking in a little bit. He may not really mean it right now, but that's the idea, is that ultimately, if you're going to be successful and happy, it's probably not going to be through sports per se, although sports can certainly teach you a lot of wonderful things in life.
And as a parent, that has to sound good, coming from a 13-year-old.
Absolutely. He also understands that there's no way I can pay for it, unless he has a scholarship. But again, he's more likely to get an academic scholarship than he is an athletic scholarship or a joint scholarship. And that's the other thing that, I think about. Taylor had an opportunity to go and play football down at Trinity on scholarship. But for him, it wasn't worth it because he had been hurt and he knew that he was at risk to have continued problems with his back, that he wouldn't get to play. Sports again does create some opportunities, but I would rather have them go play Division III ball at a wonderful private, liberal arts university, getting at least a partial, ride. Than play Division I. They're probably less likely to get hurt too.
Yeah, exactly.
So
they can, yeah. You kind of mentioned it earlier, just how much attention there is on concussions in today's society. When I talked with Steve August last week, he had mentioned there was no concussion protocol. They didn't even know. Mm-hmm. Back in the 70s, they didn't. You got hit and had your bell rung, as he said. It wasn't even a term that they used.
Right.
And in today's day and age, somebody gets hit in the head, as minor as it might be, the worst thing's about to happen
mm-hmm.
to them, apparently. Do you think the media blows it up a little too much, or do you think that it is at the stage it's at, and it's correct kind of where it's at?
I think it's correct where it's at. I think that even if the media is magnifying this is a major health risk. And until we know more about the impact of concussion and how to avoid concussions, we need to err in the direction of sitting people on the sidelines, sending them to the neurologist, pulling them out. I read a story the other day of a kid who essentially, after his second or third concussion, he was pulled out and was even pulled from his college classes and gradually reintegrated back in so that he was not overstimulated. So we're in the process of developing these protocols to protect kids. And I think that's exactly what we need to do. Kids don't always make good decisions, right? And one of the decisions I don't think they should be able to make is to continue playing when they have clearly been at risk because of previous concussions.
Yeah, and the NCAA is currently in the second year, I think, of a 3-year study, but that is hoping to get elongated, just an overall concussion study. I actually went to the University of Michigan and talked to one of the guys who's heading the research, Dr. Broglio, And he talked to me about just the magnitude of their study, that they cover every varsity athlete in Division I.
Not just football, right?
Yeah,
Yeah.
every sport.
Right.
And their highest rates of concussion instances are women's ice hockey, women's soccer, and I think football. But women's ice hockey and women's soccer far surpass what football does. And he talked about just mainly because of the build of a female versus a male. But he also talked about concussions, just the extent of them. He said Susie, who goes up for a header in a soccer game and gets elbowed by the opposing player and comes down with a concussion, that the magnitude of that concussion and the effects of it are the same as wide receiver A running across the middle and getting clobbered.
Right.
So one might be completely knocked unconscious, the other might hardly know that they are being affected, but the effects of them are essentially the same.
Right.
And what I thought was interesting was what we don't know. Can you just kind of take me, just as a psychologist? I mean, you work a lot with kind of the brain and just how people think. But how much of the brain is a mystery, in that we just have absolutely no idea where certain, just how much of the brain is a mystery?
Oh, I think that it's safe to say that although we've had incredible advances in the last 30 to 40 years in terms of what they now call neuroscience, we still have so much more to learn. How is it that some people can sustain continued brain injury and not show significant damage, while other folks after less intense concussions, fewer concussions, begin to show signs of brain injury from which they don't recover. How is it that some folks evidence recovery over time and other folks don't? Why did Muhammad Ali develop the kind of dementia that he developed and other boxers don't? So that part is still an incredible mystery. What we do know is that the brain can recover under certain conditions. If you are younger and brighter when you sustain an injury, your chances are better of recovery, assuming you don't have additional head injuries. There's also research that shows that once you've had one head injury, you're more likely to have another. And so we have this data currently. We still need a tremendous amount more to understand who's at risk, how is it that we facilitate recovery from concussion and other even more serious kinds of brain injury that involve serious tissue damage and trauma, and help people compensate for that. So I think the good news is that we now have many more tools to really assess what's taking place at the cellular level and neurochemical level to see what's taking place when an injury occurs and what happens when people recover and how they recover. So.
And the beauty of what I'm putting together is I love all viewpoints on this subject. I think it's fascinating to see. Clint is very passionate about football. He has a military family background. His dad's the offensive line coach at Florida State. So
right.
Two brothers that coach in Division I. So his whole family it's a militaristic football background, basically, what I like to call it. And he talks openly about it. He says he thinks the game has gotten soft. He doesn't like the direction it's headed in. And he thinks that just the nature of the game and how it's played is not necessarily what we know as football. As just your opinion on it, how important do you think are the changes to the game, the rule changes, for instance, you see the targeting rule in college really come into play. Are those necessarily beneficial to the game, or is it more important to see just the game be taught the right way and people play it the right way?
I think that I would disagree with him. I don't think that we're getting soft. I think that part of that old cultural mindset, that warrior mentality, is that, hey, it's just part of it. Well, it's also a huge business. And most of the people making most of the money are not the ones getting injured. I think there's some accountability issues. We don't let 12-year-olds ride motorcycles. We have helmet laws. We have a greater responsibility to take care of people, I think, who aren't in a great position to take care of themselves. My opinion, quite honestly, is that Division I college athletes are involved in a business for which they pay a huge price and they're not compensated. So my belief is that we need to continue to look at keeping these individuals safe. I don't think the game is any less exciting for the public for having these rules. I don't think there will be a time in which we essentially put them in bubble wrap and let them wander around aimlessly on a field bumping into each other. I don't see that ever happening. So it's always going to be a game that is aggressive and has a lot of contact. Can we make it safer? Sure. And why wouldn't we want to make it safer? Really? I mean, it's all okay until you're the guy with a spinal cord injury. Okay.
That's just what. Yeah, I remember. I was such a tiny kid when it happened, but some guy who played for the Lions in the '90s. I just remember watching the game, and the guy. It was like an hour delay because the guy just was paralyzed on the field from a hit.
Mm-hmm.
And I mean, sometimes the hits you see are definitely. I mean, they're entertaining to people,
sure.
Like you say, with the society we live in, but what price?
Exactly. Well, and I think you know this too, Zach, that the issue is that when I was in high school, when I talked with my friends that played football, nobody went to the weight room. There wasn't weight training. You didn't practice year-round and have weight training year-round. The athletes are bigger, faster, the velocities are greater, the impact is greater. It's a very different game. So the risks are higher, and I think we should attend to those. Not that we should, ban football, but that there's no reason that we shouldn't be making sports safer for individuals.
Go ahead.
Sports are a part of our culture, and they I think they always will be, but they can be safe and still be fun and enjoyable.
I really like that point. Back, like you said, there was no weight class or anything like that. And Steve talked about that with me last week. He said, as NFL players in the 70s, there was no off-season workouts. There was no requirements.
No,
Most guys had a job in the off-season.
They had a job. Yeah, they smoked cigars and drank and hit the bars, and then showed back up, 40 pounds overweight, and would have to get back in shape again.
What do you think as far as the just concussion protocol that there is? Have you seen anything out there? Have you had any of your son's maybe teammates or anything receive or have concussions? And have you noticed just the protocol that goes through taking them to the doctor, tests that are done? Mm-hmm. How do you think that is today? Has that improved over time?
I think it's, from what I've seen, especially at the grade school level, but even at the junior high level, is that it's improved dramatically. I think it's, from what I've seen, it's taken very, very seriously. And when a kid gets his bell rung, you see people over there immediately paying attention, going through the protocol, and taking their helmet away if they need to. You see parents more attentive. I think that the media attention has made parents more aware of the potential issues, so that they're likely to follow up and take their kid in, for a neurological examination and to follow those recommendations.
My title for this piece is called "For the Safety of the Game," like for the love of the game.
Mm-hmm.
Safe.
Mm-hmm.
What do you think of that?
I think that's great. That's great. There's, we live in a society that treasures individual freedom, and yet we don't do certain things to help protect people, especially in the context of sports. But we all pay a price for that. It's kind of like helmet laws and motorcycles. If somebody is out riding their Harley without a helmet and they get a head injury, who pays for that? Okay? You'll pay for that, and I'll pay for that, because their insurance may not cover it, and they're going to be in rehab for months. Okay? And then they're going to be unemployed, and who's going to pay for that? Okay? So from the same, I mean, I think there's a societal responsibility to help people protect themselves. Not that I'm a believer in the government intruding on our everyday life, but there's that issue of I think that we need to make these games as safe as we possibly can. It's in the best interest of everyone, including you and me.
Yeah.
So.
Anything that you can think of that we maybe didn't touch on that you're passionate about or anything?
The other thing I would just add is that I think that every good parent takes these issues very, very seriously and thinks about them, and the decisions are not always easy to make. And you, at least for me and my wife, we talk about this regularly. What are we willing to do to keep our kids safe, and what are we willing to allow them to do in terms of sports and any other aspect of their life that could involve some risk. So it's hard.